Come join seniors from the surrounding 9-county region for the Can't Miss It senior event, the Cabarrus County Senior Health and Wellness Day, on March 10th from 8:30 a.m. until 2 p.m. at the Cabarrus Arena and Events Center. The day will start off with a free breakfast, continues with exhibits, entertainment, active living demonstrations, a free lunch, and much more. Meet with the exhibitors that will provide you with information important to your life, from health screenings, fitness and fall assessments, to medication review, and a safe way to dispose of those out-of-date medical supplies. Here is just a sample of the type of information that may help and change your life.
Senior Health and Wellness Day is a great opportunity for older adults to see some of the services and resources that are available to them. A lot of organizations will be out there doing screenings of various types. I know that Carolinas Medical Center Northeast will be focusing on glucose and cholesterol screenings, as well as blood pressure and others. It's important to test your blood pressure because hypertension or high blood pressure is known as the silent killer. People don't really feel it when they have high blood pressure unless it gets super, super high. But even a few points above normal, and normal is now 120/80 or less, can be hard on the heart and the blood vessels, the brain and the kidneys. And those are all very important organs that we can't live without. So we hope to check blood pressure for the people who visit Senior Health and Wellness Day and help people decide whether their readings are such that they should call their doctors. People often don't understand cholesterol. We'll be doing a fingerstick cholesterol reading that gives you your total cholesterol results right there on the spot. It takes about 3 minutes with a single finger stick. At that time, we can tell people what their reading is and advise them according to the American Heart Association guidelines of how to handle that result. If a result is over 200, then they will be referred to their healthcare provider for information on what to do next. There are often simple dietary and physical activity changes they can do that will help. Sometimes medication is needed. The current recommendations are to focus on a plant-based diet predominantly. What are plants? Well, we all know fruits and vegetables are plants, but did you realize that grains are also plants, such as oatmeal, bread, pasta? What about nuts? We don't think of that as being a plant-based diet. Beans are another good example of a plant-based diet. Dried pintos, that's a favorite in many homes in the area. Peanuts, things like that. We're also doing some glucose testing, which is to test for diabetes. That's a test that many people think they have to be fasting for, but indeed they don't. We have a range of normal for people who have eaten that day. We will invariably find 2 or 3 people at Senior Health and Wellness Day who are probably diabetics and they don't realize it.
This year at the Senior Health and Wellness Day, we are going to be providing free osteoporosis screenings for the folks that come out. It is a very popular screening. We usually have a lot of folks waiting in line because it is unique. A lot of people don't get a chance to do it unless they go to their doctor's office, and it is a screening. So we give the folks the result and we encourage them to go to their physician, but it gives them an idea of how their bone density is and their risk for osteoporosis. People that need to get checked for osteoporosis, those at high risk are Caucasian or Asian descent, age. And a lot of folks think that only females get osteoporosis, and that is one question that is really predominant in our group. A lot of men come by, they want information, but they don't think that they're at risk for osteoporosis. But out of the 10 million folks that are diagnosed with osteoporosis, 80% are female, 20% are men. That's 1 in 5. So we encourage the men that walk by to stop, take off their shoe, get screened, and get the information from us, because then we can give them the teaching and the little hints afterwards about ways that they can improve their bone health as well. We encourage them to eat a diet that's rich in calcium and vitamin D. Calcium is very important for strong bones. Vitamin D as well. Then also we encourage people to stay active, weight-bearing exercise, anything that causes you to bear your weight, Walking, jogging, dancing is very important to protect bone health, as well as strengthening and balance exercises. Because if you think about, if you work on your balance, that prevents you from falling in your home, and that's when folks get in trouble, because when they fall, they could break a hip, break a wrist.
The research from the American Cancer Society, which states that 1 in 8 women will be affected or be diagnosed with breast cancer, and that statistics from the last 2 years have stayed pretty constant. 1 in 400 men will be diagnosed with breast cancer, and our only weapon for breast cancer, we can't prevent breast cancer. Our only weapon is early detection to fight breast cancer. The reason I say that is that the 2 main risk factors for breast cancer remain, number 1, being female, and number 2, aging every day. And those are 2 things we cannot prevent or change. And so because of that, we teach women the triad of early detection for their protection. And so the first part of that triad is to make sure they get their mammogram. The guidelines remain from the American Cancer Society for women aged 35 to 40, if they've never had a mammogram, to go ahead and get their baseline mammogram. After age 40, they should have a mammogram once a year, a screening mammogram. And that takes them about 15 minutes once they're in the breast center or on the mobile. And then the second part of that triad is a clinical breast exam. The guidelines are that women should have a clinical breast exam every 1 to 3 years, provided by their physician or nurse practitioner or other practitioner that is certified to do those. The third step of the triad is the self-breast exam. And we ask women to do this self-breast exam once a month, the same day of every month. And we talk to women depending on their age, where they are in their cycles, about when to do that. And we teach a very thorough method. It's called the MammaCare method of self-breast exam. It is a little different than the method they've learned in the past that they did with in the shower. It's valuable information. It's very thorough. And this method will help them to find anything that might be in their breast. And this method also includes the visual exam, which is watching for any changes they are feeling for and watching for any changes in their breasts. And we go over these changes when we visit them and talk with them. Everyone's worried about lumps that they find. It's important for women to know that most lumps are not cancer. And another concern that I hear from women is a statement such as, I don't want to do my self-breast exam because I'm afraid that I'll find something. And for that same reason, women put off getting their mammograms. And so we like to remind women, men too, but especially women, that again, early detection, that's our only weapon. That's what we have to do to protect ourselves from breast cancer and to treat it early. We can't prevent it. So we have to use early detection, and those 3 parts that I mentioned are essential. Most women don't have breast cancer, but 1 in 8 do. So that's why breast health, the screenings that you have, the mammogram screenings are so important. Your self-breast checks are so important. And keeping track of any changes and knowing your breast tissue. And that's why we teach the method of self-breast exam that we do. You become so familiar with your own breast tissue that you will know for certain if there are any changes.
Operation Medicine Cabinet is a program where we, alongside with the police department, collect old and expired meds from folks. It's a green kind of a project because you're not supposed to flush medicines down the toilet anymore. You're not supposed to put it down the drain. You don't want to put it in the garbage. The dogs and the kids can get at it. You don't want to leave it, expired meds too, you don't want to leave that in your cabinet and take it by mistake, and a lot of seniors can do that. Also, there's a problem with theft. I'm afraid grandkids are stealing medicines out of grandma's cabinet when she's not looking these days too. So we're offering a chance for folks to get rid of all those kind of medicines in a safe, environmentally safe, legal way.
we can take prescription medications. We can take over-the-counter medications. We also, if you have cough syrups or powders or anything like that, we've even taken needles. Amazingly, one of our collections was 20 pounds of needles. If you can imagine how many that would be, it's incredible. And we and the police department look forward to getting needles, medications, all of that out of the homes and out of our community that are not necessarily needed anymore. It provides for a safer environment in our community all the way around.
We'd love for folks to start thinking about it right now and telling their friends and neighbors, go visit grandma or mom and dad and see, just check the cabinet. A lot of folks, we've gotten medicines. We had Vicks bottle from 1936. I mean, folks don't clean out their cabinets very often. So it's a great time to go just take an inventory, get rid of everything that's expired. You forget, I think my dad had Bear aspirin from 1968 in his cabinet, and he still wanted to use it. They're not supposed to use that stuff anymore. Also, if you have some expired medicines from your pets, we're collecting that too. A lot of them ask, do they have to take the medicines out of the bottles, or can they bring it in the bottles? And we say, yes, keep them in the bottle. You can keep the label on it. You're not supposed to travel with meds in a bottle unlabeled. The law doesn't like that very much. So we bring them in the original bottles with the prescriptions. If you'd like, you can black out your name and address just for confidentiality's sake. But we do destroy all the labels off the bottle so that they are, no one can get a hold of any pertinent information. It's going to be a drive-through. Drop off and drive through. You won't even have to get out of your car. You can drop it off and then go park and get into the wellness fair for all the other activities. We hope everyone will come, like I say, and tell your friends and neighbors about it, because it's a great project and it does a lot of good in a lot of areas.
So please come out to the Senior Health and Wellness event on March 10th from 8:30 a.m. until 2 p.m. at the Cabarrus Arena and Event Center to visit with friends, enjoy breakfast and lunch, learn about your health, and ways to live that wonderful life you deserve.